We have done it before, and we can do it again. We have vaccinated India against polio and smallpox, and we have won those wars.
Polio we were fighting for many years, and eventually after 8 years, we now have polio-free India. But for many years, the campaign was not working. People were skeptical about, taking these 2 drops and giving it to their kids. Why don't we design a campaign where you actually get angry with everyone? And it worked. We changed the language, I got aggressive, and so why aren't you taking your kids and so on and so forth? And eventually when we were called to United Nations head office, and the chairman there of WHO and the others, they asked a lady who was one of the ladies from the village who had actually taken care of their kids and done this, said, why did you change and what made you change? She said, वो अमिताभ बच्चन जी आए, बहुत नाराज थे, तो हम डर गए, हमने जाकर के दवाई दी. I just said, get out from your home and get hold of your kid and put those 2 drops inside their mouth.
Otherwise, I'm coming.
I'm coming, otherwise,
Now we have a new enemy, COVID. And there is only one proven and permanent solution. Vaccinate, vaccinate, vaccinate. Doctors say the best vaccine is the one in your arm. The rumors around vaccines are false and misinformed. Those countries that have defeated the enemy virus so far are those who have vaccinated their people. We can do it. India has done it before, and we can do it again. India must stand up and be vaccinated now. The COVID-19 vaccines can protect us. They are essential. And we know they're absolutely safe. We know you still might have questions. Effectiveness, who can get it, where to get it. NDTV, in partnership with Google, presents Vaccinate India, a campaign that will keep you covered at every step of the vaccine journey. Roll up your sleeves and do your bit, because getting back to the moments we missed starts with getting vaccinated.
Hello and welcome to Vaccinate India, a program very, very close to our hearts. In fact, this program also lies at the core of what our partners Google want to share, the critical need to ensure that millions across India vaccinate. Protect yourself, your families and your friends. In the course of this program, we'll be sharing basic information with you. The goal is to fight COVID together. This is key to winning what many say is the battle of our lifetime. On this show, some of the finest experts from India and around the world on why you need to vaccinate, how you fight off COVID if you have common misconceptions. Everyone has a million questions. In fact, we'll get experts to address some of the most common ones. And finally, the voices of our heroes. Frontline doctors, healthcare workers, they have been our relentless warriors against COVID. Didi?
बिल्कुल, कोविड दुनिया भर के सामने एक गंभीर चुनौती है और हमारा देश कोविड की दूसरी लहर से उबर रहा है। इस बीमारी से मुकाबला करने के लिए वैक्सीनेशन, टीकाकरण बहुत ही महत्वपूर्ण औजार है। हमारी कोशिश है कि ज़्यादा से ज़्यादा देशवासियों को टीका लगे। गूगल के साथ भागीदारी में एनडीटीवी लाया है वैक्सीनेट इंडिया, जिसका आगाज़ आज के इस टेलीथॉन से हो रहा है। आज हम टीकाकरण की ज़रूरत, उस तक पहुंच और कुछ लोगों के मन में जो डर है, हिचकिचाहट है, उस पर बात करेंगे। इस संक्रमण के लक्षण, इलाज और भ्रांतियों पर विशेषज्ञों से चर्चा करेंगे। आइए सब मिलकर जुड़ते हैं वैक्सीनेट इंडिया से।
Yes, Nidhi and Vishnu, you're absolutely spot on. there's probably nothing more important now than vaccination, vaccination, vaccination. You know, we're all looking at how this virus originated, what is the number of cases. Our problem now is to vaccinate, and why? Well, I'd just like to present you some amazing figures produced by our team at NDTV on why it's important to vaccinate. And we'll just go through them in these graphics to understand the importance of this entire program focusing on vaccination. Well, first of all, just look at this. COVID waves, they are getting worse and worse across the world. We looked at data from the 30 top countries that were hit by COVID, 30 of the biggest countries. And the first thing you notice is that between one wave and the next wave, there is a 5.5 month gap. That's the average. Of course, some are 4 months, some are 7 months, but on average, 5.5 months from the peak of one wave to the peak of the next wave. That's number one. So we should think of waves coming every 5 to 6, 7 months. Secondly, the key worry is the next wave is always much worse than the previous wave. In fact, on average, it's been 75% higher in terms of the number of cases of COVID in a country. So like if there were 100,000 cases, the next wave will have 175,000 cases. It's that much difference, almost doubling. So that's the first big worry. So that's for the 30 top countries, as we mentioned, across the world, average figures. Then let's just have a look at how India compares with those. And you look at the data here that the team has brought out, and it shows that India's COVID spreads and intensifies much more than the rest of the world. So remember the rest of the world, let's have a look at that graph on its own again. And on top of that, if we superimpose the Indian graph, these are the number of cases in India, and you can see it shoots up much more than the rest of the world. So first thing about India compared to the rest of the world, while the gap between the one peak and the other peak in the rest of the world, remember, is 5.5 months. In India, the gap between one peak and the next peak is 7.5 months. So it takes longer for a next wave to come to hit India. But what is really worrying is that India, the next wave tends to be much worse than the first wave. If we look at the number of cases in the second wave compared to the first wave, how much percentage higher is the second wave? In India, as we see, 320%. Second worst is America with 295% more cases in the second wave compared to the first. Then Indonesia comes third with 200% more. Then Russia with 150% more. And Argentina is fifth with 115% more. So average for the world, as we saw earlier, second waves are 75% higher number of cases than the first wave. So that's the big worry, that the next wave could be so much worse than our second wave. So what we need to look at is how bad and how likely is the next wave going to be in India. So first of all, let's look at, are we immunized? Does our population have immunity, or what extent of our population has immunity? Just look at this now. How many people in India now have immunity? First of all, the percentage of population of people who have had 2 doses, and remember, to have real immunity, you need 2 doses. It's now 3.4% of our country, our population. Plus, let's add to that how many people have already had COVID-19, and that's another 2%. So you can say that you can add the two. There's some overlapping, of course. Some people with COVID had a vaccination, etc. But just let's say, adding the two, Indians with immunity now are 5.4% of our population. That's not much, and that is a worry. So we got to increase that immunity level. We must make sure that we go up from 5.4 to a much higher level. Remember, in America, it's like 50% immune now. England, 50%. It's really, really high. So how important is vaccination? Here it is. How many people will have immunity by December, by the end of 2021? First of all, vaccinations, let's say they continue at a rate, current rate, which is 2 million a day. And actually it's been a little less for this month, but let's say it stays at 2 million a day. That carries on right until December. From 5.4 current immunity, we will go up to 21% immunity in this country. That's better, but just not good enough. Now, what happens if, and we've talked to a number of experts and vaccine producers, and they say in August, things are really going to pick up. So let's say it goes 2 million till August, and then August, it jumps up to 6 million. In that case, by December, we'll have gone from our current level of 5.4% of the population immunity to 43% immunity. That is now becoming much more helpful in trying to stop another pandemic. But if we get to our dream figure, our target figure of 9 million doses a day, that's not impossible. China is doing 15 million. We can do 9 million. We can do it. If that happens, let's say after August, we give it a 2-3 months, and then it spikes up to 9 million. By the end of December, we will have 60% of our country immune, with immunity. That will have a huge impact on trying to prevent the next wave. So what is the connection between vaccinations, amount of vaccinations, and the waves that are coming one after the other of COVID? This is what it looks like. Now let's first look at how bad will India's next wave be. First of all, if we did no vaccination, we would have 1 million cases per day, maybe 1.5 million cases a day. That is just terrible. Remember, our peak currently was 400,000. It could go up to 1 to 1.5 million. That is unbearable. But if we vaccinate at 2 million per day, 2 million doses a day, we will end up with a wave that is not quite as bad, but still pretty high, higher than the current wave. Now, if we vaccinate at 6 million a day from August onwards, and we hit 43% of immunity, then the wave comes down dramatically. And the wave in December or January to March is when it's expected next, will be lower than the current wave. So that's crucial, 6 million. But it'll still be high, but not as high as it was this time. And finally, if we hit 9 million vaccines a day from August onwards, there will be no next wave. That's the dream. 9 million vaccines, you will not have another spike of COVID in India. That's what we want to achieve. Nidhi and Vishnu, isn't that's the key of this whole program. Vaccinate. The more you vaccinate, the less likely and you will have another spike and another wave. It's so important. Vaccinate, vaccinate, vaccinate.
Well, the effort of this program is to vaccinate, vaccinate, vaccinate. Tell people there is simple information available and explain the need to vaccinate. In fact, on Google, if you do a basic search of coronavirus vaccination statistics, you can actually give an idea or get an idea of where India stands. And this is where we are at this stage. Now, around the world, 184 crore doses have been given. India has given 20.3 crore doses. As an absolute number, that sounds impressive. But as a percentage of our population fully vaccinated at 3.1%, that's still very, very little. China has vaccinated 60.3 crore of their population. The United States has vaccinated 29.2 crores, but as a percentage of their population, 40.7, which is why you see people now out in the United States in parts not wearing a mask, because it's actually safe enough to do that. If you look at India's overall vaccination efforts, then as you can see, this large green band, light green, is actually people with 1 dose of the vaccine. And it's this one which is actually people who are fully vaccinated that needs to go up. So on the 28th of May, at least 1 dose, 11.8% of our population fully vaccinated, just 3.1%. And that's something that's always been the case. Fully vaccinated numbers, for example, on the 25th of April, 1.6%, at least 1 dose, 8.6%. We need to get as many people vaccinated with 2 doses, given what we are seeing about vaccine efficacy. Again, percentage of our population fully vaccinated, 3.1%. Let's bring you a little bit more detail about where you can actually go to get vaccinated. Again, it's very, very simple. Let's find out vaccination centers near me. Just on Google type coronavirus vaccination centers near me. As you can see, lots of hospitals and healthcare centers have actually been marked out. Where do you want to go? You actually have a fairly good choice because people have reviewed them as well. So let's go to the one closest to me. I'm just going to click on it. You've got the name of the hospital which appears. You've got its exact location right over there, and then you've got reviews of people. It's been reviewed at 4.1. The guidelines are given, the vaccine location, appointment is required, limited to certain patients, and then what exactly are people saying? So doctor and ward nurses and its staff were very kind. Somebody said it's not very clean. Somebody else said it's a very patient-friendly place, maintaining excellence in healthcare. And let me just make this point one more time to give you an example of how it is relatively easy to find out information about a place you want to vaccinate in. Let's go to the second hospital over here. Again, that location comes up on my map. It's actually quite easy to find over there. This is rated higher at 4.4. Again, the directions are very, very clear over here in terms of the appointments which are required, its limitation to certain patients. I was impressed for my COVID-19 vaccine, really impressed by the arrangement. Doctors and staff are very nice, excellent service. The food was fresh too. I assume this patient was actually in this hospital for another purpose. But again, the point is simple information available on Google. You need to access this to know where you can go to get your jab, because you need to get your jab fast.
We have with us a very special person now, Soumya Swaminathan, Chief Scientist, World Health Organization, a person who understands the seriousness of this pandemic throughout the world. As Dr. Roy just explained, vaccination is the need of the hour. Soumya ji, how soon before the WHO clears Covaxin and Sputnik?
So the process in WHO is for the emergency use listing has been clearly laid out on our website for many months now. We encourage vaccine developers to start submitting their data as soon as they start collecting their data, even from phase 1 onwards, what we call a rolling submission. So we have conversations with many vaccine developers that are going on, and also with Bharat Biotech, who makes Covaxin, as well as the Gamaleya Research Institute for the Sputnik V. Now, there is a process where a dossier has to be submitted, which has the phase 3 data, as well as information on the quality manufacturing practices. In some instances, there is need also for a physical inspection of the premises. In the case of Bharat Biotech, a lot of vaccines pre-qualified by WHO earlier, so there is a track record. And I think once the data submission has been completed, there is a conversation planned with them in the coming weeks. So it should happen within the next 6 to 8 weeks. It's difficult to give a timeline just now because we do not have a complete dossier. Similarly, for Sputnik 5 also, there is some data that's been submitted, more data is awaited, and the team actually is in the ground in Russia, currently inspecting the premises and having the conversation with the local manufacturers. So that is also likely to take time frame of 4 to 6 weeks, or maybe within 8 weeks.
Good to see you, Dr. Soumya Swaminathan. Thank you very much for joining us again. I remember you came on our show at the beginning of the pandemic, and you really helped us understand what it was and what to expect. Thank you very much, and congratulations on doing a wonderful job at WHO under very tough circumstances. What everybody wants to know is how effective are the current vaccines against all these new variants, the South Africa variant, the Brazil variant, the Kent, the UK variant, and now this B1.617.2, the variant found in India, which is spreading across the world. How effective is the vaccine of any kind against this? Number one, the efficacy in terms of getting it even a mild or moderate symptoms versus also the efficacy against it getting a severe attack like hospitalization or a fatality. These two levels of efficacy. Could you tell us what the current estimates are of the vaccine's efficacy?
Yes, so first thing to understand is that the science is evolving and there is not a lot of data out there. There are some laboratory experiments, where you take this particular strain of the virus and you expose it to convalescent sera or sera from vaccinees to see whether there is inhibition. Those kind of experiments actually show that there is the 2 to 4-fold lower level of inhibition or neutralization when you use this strain. So definitely this strain, also like the B1351 from South Africa, it needs a higher level of antibodies to actually neutralize it. So that's in the laboratory. What is much more important are the clinical studies and the effectiveness studies that come out of countries. And this is where I think it will be really useful to get the data from India, because it's the largest number of vaccines have been deployed in India, the Covishield and the Covaxin. Analysis of that data is what's really going to give us the required information. There are small studies from the UK which have got a lot of people worried now because it seems to show lower efficacy against the AstraZeneca vaccine, particularly after one dose. But what I would say is that it stimulates enough immunity, both antibodies and the cell-mediated response, what we call the T-cell immunity, to fight severe disease leading to hospitalization and death. So as far as we know, these vaccines are all still effective against those bad outcomes that we are most worried about.
Dr. Swaminathan, how important is it for us to be focusing on vaccines for children?
So this is where I think we are looking at a longer term goal. And I think if we really want to bring this infection down to levels which are extremely low, I'm not talking an elimination at this point, but extremely low, then there may be a stage where we need to vaccinate children, because we know children get infected, even though they rarely get ill. They do get infected and they can spread the infection, particularly older children and adolescents. However, because there's a clear link between age and comorbidities that go with age and the severity of the illness and the outcomes, the bad outcomes, we need to focus on the vulnerable groups first. And as long as there is a global supply shortage, most countries are in a very supply constrained situation right now. We need to continue to focus on those high priority groups that have been clearly identified by the WHO's SAGE roadmap for vaccination. And ultimately, we'll get to the point where we will vaccinate children. We're also gathering more data now. Many of these vaccines have still not been tested in children. We've just seen data from Pfizer and Moderna, but the other vaccines are also being studied in children. So safety and the dose needs to be established. And also, I think in the prioritization, children, except for those very few vulnerable children, there are children with underlying illnesses who may be more vulnerable, who may want to be prioritized, but that's going to be a very small number.
All right, Dr. Swaminathan, wonderful as always to speak to you. Very privileged to be joined by another great speaker and a brilliant communicator of science, Dr. Randeep Guleria, the director of the All India Institute. Now, Dr. Guleria, it's a point we just want to keep stressing over and over again, so it's a basic question, but do please tell us, why is it so important for us to get vaccinated? And for the benefit of those who are watching our information campaign tonight, who can get vaccinated at this stage?
First of all, I think vaccination is one of the most important weapons that we have to fight against COVID-19. And it's going to pay dividend over the long run. Along with vaccination, of course, COVID-appropriate behavior, aggressive surveillance needs to be done, especially during the time when we don't have enough doses to vaccinate as many people as we would like to do. Coming to the question of who should be vaccinated first, I think, as was mentioned by Dr. Swaminathan, that we need to really focus first on the high risk group, the elderly, those with comorbidities, and then come down to those who can have illness but will usually have a mild illness like children or young adults. Over a period of time, when we have enough doses, then we should try and vaccinate as many people as possible so that we can break the chain of transmission. So we are looking at two things. One is decreasing our overall number of cases so that the chain of transmission is broken. And secondly, decreasing our mortality by really vaccinating those who have a higher chance of getting more severe disease. And I think that is the priority that we need to follow.
Dr. Guleria, thank you very much for joining us. You've really been the fountain of information throughout this pandemic. So what I would like to ask you is, vaccinations have to go up in the numbers per day. We need to hit 6 million a day to 10 million a day in the next 3 months, and then carry on till December if we want to stop the third wave in India. How do we do that? How do we increase that capacity? Because it does take time for plants to be created and manufacturing to be done. How do we go from the current 2 million to even 6 million or 9 or 10 million? What are the steps we need to take now? It's so important in stopping the next wave.
I totally agree with you. I think the most important thing that we need to do is start touching 10 million doses a day. And to do that, we really need to see how everyone can come together, the manufacturers, the government, and everyone, to support each other so that we can get more and more doses and then work on getting those doses into people's arms. So that strategy needs to be developed. So we need to look at it in 2 or 3 ways. One is, how can we support the manufacturers, whether it's the resources that they need, whether it's the funding that they need, so that they can quickly ramp up manufacturing to the doses that we need, to the amount of doses that we need, both whether it's India or from outside. Can we get more manufacturers on board if they have the capacity, and start having more and more doses available every day? And the second most important thing is to develop a strategy so that we can deliver it into people's arms. And when we're talking of delivering it into people's arms, we're not looking at cities only. We're looking at rural India also. How can we reach out to everyone's home and say, look, we have the vaccine for you. Please come and take the vaccine. So a strategy needs to be developed where people who may not be tech savvy, who may be hesitant to come to a vaccination center, can also be vaccinated, whether it's a mobile mechanism, whether it's taking them to a vaccination center. And all of that needs to be done in the time that we have till we have enough doses available. So I think we need to have a multi-pronged approach, and we have to have set a timeline that, okay, let's say by July we will have enough doses, but by that time we have a mechanism in place so that every citizen can be reached to and vaccinated. Right. If we have developed that strategy, I think we should be able to achieve 1 crore vaccines a day.
डॉक्टर गुलेरिया, अभी भी कई लोग ये सवाल पूछते हैं कि कौन सा वैक्सीन बेहतर है जो हमारे देश में उपलब्ध है, ये लें कि दूसरा लें, या दोनों ही सुरक्षित हैं?
तो मैं यही कहना चाहूँगा कि दोनों ही सुरक्षित हैं और दोनों ही इफेक्टिव हैं। अभी तक हमारे पास जो भी डेटा है उसमें यही दिखता है कि कोई भी वैक्सीन जो मिले हमें लगा लेनी चाहिए। अभी वी आर नॉट स्पॉइल्ड फॉर चॉइस। हमें जो वैक्सीन मिल रही है, मैं तो सब लोगों को यही कहता हूं कि आपको जो वैक्सीन मिल रही है आप लगाएं, आपको प्रोटेक्शन मिलेंगी। और डेटा ये इमर्ज कर रहा है हमारे कंट्री से भी कि जिन लोगों ने वैक्सीन लगाई थी उनको लेस सीवियर डिजीज हुई इस वेव में। और इसलिए मैं सब लोगों से ये अपील करूंगा कि अगर आप उस ग्रुप में हैं और आप वैक्सीन लगा सकते हैं तो जो भी वैक्सीन मिल रही हो आप उसको जरूर आगे आके लगाएं।
बिल्कुल, बहुत बहुत धन्यवाद डॉक्टर गुलेरिया ये कहने के लिए कि लोग सुने कि घबराएं ना टीकाकरण से, जो भी वैक्सीन मिल रही है ले लें उसे। बहुत बहुत धन्यवाद डॉक्टर गुलेरिया जुड़ने के लिए। और हमारे साथ खास मेहमान हैं रघु शर्मा जी, मिनिस्टर फॉर हेल्थ एंड फैमिली वेलफेयर, बाल कल्याण विभाग से हमारे साथ हैं राजस्थान से। शर्मा जी, मेरा सवाल आपसे ये है कि आपकी सरकार ने कहा कि राजस्थान ने तो पिछले नवंबर से ही टीकाकरण की तैयारी कर ली थी, तो आप लोगों की रणनीति क्या रही?
देखिए, राजस्थान पूरे देश में भौगोलिक दृष्टिकोण से सबसे बड़ा प्रदेश है। हमारे यहाँ रेगिस्तान है जहाँ छितराई हुई आबादी रहती है, आदिवासी अंचल है जहाँ पे एक एक पहाड़ी पे एक एक मकान रहता है। तो बहुत बड़ा चैलेंज है राजस्थान के 8 करोड़ लोगों को वैक्सीनेट करने की। तो हमने अक्टूबर से तैयारी कर दी थी। अक्टूबर, नवंबर, दिसंबर और 16 जनवरी से ये शुरू हुआ। करीब 3.5 महीने तक हमने साइट्स डेवलप करने के लिए, मैन पावर की ट्रेनिंग के लिए, स्टोरेज सेंटर बनाने के लिए, कोल्ड चेन पॉइंट डेवलप करने के लिए तमाम तैयारियां 3.5 महीने तक हमने की। सबसे बड़ी बात है कि स्टोरेज के हमने 3 सेंटर राजधानी जयपुर में बनाए, जहां हम बम्पर स्टॉक को स्टोरेज कर सकते हैं। 7 हमारे संभाग हैं, वहाँ पे हमने स्टोरेज कैपेसिटी डेवलप की। और 34 मेडिकल के डिस्ट्रिक्ट हैं, हर डिस्ट्रिक्ट में हमने स्टोरेज की कैपेसिटी डेवलप की। 2444 कोल्ड चेन पॉइंट डेवलप किए और एक मोबाइल वैन हर डिस्ट्रिक्ट हेडक्वार्टर पर रखी ताकि वो ट्रांसपोर्ट कर सके वाइल्स को CSC, PSC, SDH, जो भी हमारा वैक्सीनेशन साइट है उस तक। कुल मिला के राजस्थान ने बहुत शानदार तैयारी की। हमारे लगभग 54,000 तो आशा सहयोगिनी थी जिनको हमने ट्रेनिंग दी, और 56,000 आंगनबाड़ी कार्यकर्ता थी, और 24,000 ANM थी हमारी। उसके अलावा स्वास्थ्य मित्र जो हमने बनाए, क्योंकि राजस्थान में कोविड आने से पहले मुख्यमंत्री जी ने निरोगी राजस्थान शुरू किया प्रिवेंटिव केयर के लिए। उसके लिए हमने 2-2 वॉलंटियर्स हर रेवेन्यू विलेज में सेलेक्ट किए थे, राजस्थान के 40,000 रेवेन्यू विलेजेस में। तो वो फौज भी हमारे पास थी, कुछ शिक्षा विभाग के कर्मी थे। इन सब की ट्रेनिंग हमने इन 3.5 महीने के अंदर पूरी कर दी।
बिल्कुल, आपने बहुत कदम उठाए, लेकिन कोशिश ये है कि हर एक व्यक्ति जो ग्रामीण इलाके में है उस तक टीका पहुँचे। तो हर जो इस पूरे फेरिस्त में आपने क्या, जो पंचायत है, सरपंच के लोग हैं, स्थानीय लोगों की भूमिका इसमें क्या रही?
देखिए, जो स्वास्थ्य मित्र हैं ये उसी गांव के रहने वाले लोग हैं, इन्फ्लुएंसर लोग हैं जिनका सिलेक्शन हमने किया। फिर सरपंच पब्लिक से सीधा जुड़ा हुआ रहता है, उन्हीं के द्वारा चुना हुआ रहता है। रोज़मर्रा के काम, चाहे शहरी क्षेत्र में हमारे वार्ड के मेंबर हैं, नगर पालिका के चेयरमैन हैं, ग्रामीण क्षेत्रों में सरपंच हैं, उनसे हर रोज़ काम पड़ता है हर व्यक्ति का। तो उनका प्रभाव तो रहता ही है। वो लोगों को कन्विंस कर सकते हैं कि आपको वैक्सीन लगाना चाहिए, वैक्सीन से आपको कवरेज मिलेगा और इस महामारी में ये सुरक्षा कवच के रूप में काम करेगा। उनकी बातों को लोग समझते हैं, क्योंकि शुरुआती दौर में बहुत भ्रांतियाँ थी वैक्सीन को लेके। उन भ्रांतियों को दूर करना, लोगों को मोटिवेट करना और उनको वैक्सीनेट करवाना, इसमें इन तबकों की बहुत बड़ी भूमिका है, क्योंकि ये लोग गांव में हैं और वार्डों में हैं जहां रोज़ इनका इंटरेक्शन लोगों से होता है। तो जब ये कोई बात कहेंगे तो उसको लोग विश्वास करते हैं कि ये लोग बोल रहे हैं तो ठीक बात है। तो वैक्सीन का मैं समझता हूं कि हर व्यक्ति को लगाना चाहिए। विशेषज्ञ बोलते हैं 3rd वेव की बात करते हैं, 4th वेव की बात करते हैं। 3rd वेव और 4th वेव की बात के अलावा कोविड से जो नेगेटिव हो जाते हैं लोग, उनको जो बाद में परेशानियां झेलनी पड़ती है, तो ये बहुत खतरनाक चीज़ें हैं। इसके लिए वैक्सीन लगाना ज़रूरी है। कोई खतरा नहीं है, कोई आफ्टर इफेक्ट्स नहीं है। हमने खुद ने लगवाया, राजस्थान में मुख्यमंत्री जी ने लगवाया, सब लोगों ने लगाया, किसी तरह की भ्रांति नहीं रहनी चाहिए।
Raghu ji, important points over there. People just must get out and vaccinate. Thank you so much for being with us.
और अब हमारे साथ हैं डॉक्टर जलील पाकर, सीनियर पल्मोनोलॉजिस्ट हैं लीलावती अस्पताल के। डॉक्टर पाकर, आपको तो खुद कोविड हुआ, आप ठीक हुए, सेहतमंद हुए, वापस आप जल्दी इलाज करने के लिए अस्पताल भी पहुँचे। कितना ज़रूरी है कि जो हमारे डॉक्टर्स के साथ साथ जो हमारे मेडिकल के फ्रंटलाइन वर्कर्स हैं, उनको जल्दी से जल्दी वैक्सीनेट किया जाए, और बड़े शहरों में नहीं, छोटे शहरों में भी?
बिल्कुल, आपने सही कहा। मेरे हिसाब से तो आप जो कह रहे हैं कि मेडिकल वर्कर्स, फ्रंटलाइन वॉरियर्स, हेल्थ वर्कर्स जो आप कह रहे हैं, मैं तो कहता हूं कि सारे देश ने वैक्सीनेशन ले लेना चाहिए। कोशिश हमारी ये होनी चाहिए कि गांव-गांव, ग्रामीण जगहों पर भी वैक्सीनेशन पहुंचना चाहिए और वैक्सीनेशन सबको दिया जाना चाहिए। हमें ये पॉलिटिकल इश्यू बनाने की ज़रूरत नहीं है। हम सब में इंसानियत होनी चाहिए, और इंसानियत के नाते ये हमें देखना चाहिए कि हर हिंदुस्तान का नागरिक, चाहे वो अमीर हो, गरीब हो, छोटे हो, बड़े हो, जो भी हो, सबको वैक्सीनेशन मिलना चाहिए। और इसके लिए हर एक ने साथ में आकर कोशिश ये करनी चाहिए कि वैक्सीनेशन कैसे पहुंचे। या अगर आप कहते हैं कि ब्यूरोक्रेसी है या रेड टेपिज्म है, इसको आप छोड़ दें, इसको हटा दें, वो तो होते रहेगी। अब वक्त ऐसा आया है कि हमें लोगों को बचाना है, हमें लोगों को मदद करनी चाहिए। जो हेल्थ सिस्टम जो है उसकी कमर टूट चुकी है, और अगर हम अभी नहीं कर पाएंगे तो कब कर पाएंगे? हम हिंदुस्तानी हैं, हम सब ने अगर अभी एक साथ मिलकर इस कोविड-19 के ऊपर हावी नहीं हुए तो हम कब होंगे? क्यों लोग ये नहीं समझते और क्यों नहीं जाग रहे हैं? और जिनके पास पैसा है उन्होंने तो खुद से पैसे देने चाहिए ताकि हर गरीब इंसान को वैक्सीनेशन मिले। तो मैं ये चाहता हूं कि सिर्फ हेल्थ वर्कर्स नहीं, सारे हर एक हिंदुस्तानी को चाहे वो कहीं किसी भी कोने में रहे, उसको वैक्सीनेशन मिलना चाहिए। वो कैसे मिलना चाहिए ये मेरी जिम्मेदारी नहीं है। हमसे जितना होगा हम जरूर करेंगे, हम पीछे नहीं हटेंगे, हम मौत से नहीं डरेंगे, अभी तक नहीं डरे हैं, और हमारे हेल्थ वर्कर्स नहीं डरे हैं, नर्सेज नहीं डरे हैं, वार्ड बॉयज नहीं डरे हैं, हम करते रहेंगे। तो प्लीज वैक्सीनेशन अवेलेबल कीजिए और सबको वैक्सीनेशन दीजिए। अगर कंपनी अगर नहीं बनाती है तो वो क्यों नहीं बना रही है, उनके ऊपर तंबी आनी चाहिए। उनको अगर फंडिंग की जरूरत है वो हो जाना चाहिए, लेकिन वैक्सीनेशन जल्द से जल्द हिंदुस्तान में हर एक को मिलना चाहिए।
Dr. Parker, you're the best person to answer this question, which is asked by so many people, almost everybody. What are the side effects of vaccination? Of course, there's a lot of misinformation. It does terrible things to you, which is all wrong. But there is this worry that there are blood clots. That is very, very rare, right? How rare is that? Number one. Number two, the smaller side effects, like you've had the vaccination, you get a bit of a pain, you have some temperature. Should you really, as soon as you get vaccinated, should you have a paracetamol or aspirin or something just to stop the pain and to reduce the temperature, or that it's really not much and it'll go in 24 to 48 hours? What are the side effects? That's what people want to know.
See, the commonest side effects which any vaccine has, even if you take a flu vaccine or a pneumococcal vaccine, with every patient there are certain common side effects, and it might vary from patient to patient. The commonest ones are you start getting either shivers, you start getting body ache, slight temperature, headache, malaise. If you get those, I think one tablet of Crocin or one tablet of Dolo 650 does the wonders. It might continue to the next day or the third day, and I think the same tablet could be used for the consecutive days. Yes, some of them who have taken the vaccine, after taking the vaccine, both the vaccines or a single dose, if the fever does not respond, if they become breathless or their saturation drops or there is cough, I think they should go to the nearest health facility, get themselves examined, and if required, if hospitalization is required, which has happened with many of my colleagues too, then I think they should do that. But nobody should worry about the side effects of COVID-19 vaccine, whichever make it might be.
Sure.
There might be an anaphylactic reaction, but that is very, very, very rare.
Yeah. So, Dr. Parker, for people who have been infected, what should their vaccine protocol be? Will the vaccine be just as effective for them?
Let me clarify to you one or two issues. In regards to vaccination, please everybody should understand that vaccination does not give you a blanket cover against COVID-19. You might still get COVID-19. Now the question is, as to those who have got COVID already, when should they get vaccinated? We all over the world, we have flip-flop, because first we said that vaccine, if you are taking on the first day, then take it on the 28th day. You had Pfizer 28th day, Moderna on the 21st day. Then you said 45 days. Now you've come to 60 days, and now you have come even to 90 days. If the antibodies are low, I don't think anybody should wait to get vaccinated. because people have taken a dose of vaccination, have got COVID, have come out of it. If the antibodies are still low, I don't think they should wait for the second dose of vaccination. It doesn't harm anybody. On the contrary, if at all, it is going to help, because you are not going to end up with severe COVID-19 where you might go on the ventilator and you might kick the bucket too. So these discussions, I really don't understand where are we heading towards, because according to me, even today, we really do not know much about COVID-19. So whatever we are talking is with our experiences, with our perceptions, but at the same time, we have to be rational. What else can you do? So we should not misguide. On the contrary, we should see to it that people get vaccinated as early as possible. If their antibodies are really very low, then I think they should not wait for this, even for that 90-day or 60-day or 45-day moratorium.
बिल्कुल डॉक्टर जलील, आप सही कह रहे हैं कि जल्द से जल्द टीकाकरण कराना चाहिए। बहुत बहुत धन्यवाद जुड़ने के लिए। तो एनडीटीवी जो कहता है करता भी है। हमारे सहयोगियों ने जब टीका लगवाया, अपने अनुभव जो थे वो साझा किए, ताकि लोगों में हौसला बढ़े आगे आकर टीका लगवाने के लिए।
Well, it's important for us to practice what we preach. For the last 1 year plus, we've been talking about vaccination, vaccination, vaccination virtually every day. Now, the numbers thus far have been very encouraging. And today, I'm going to walk the talk. I'm going to get my vaccination as well. It's something I've looked forward to for a long time. Thanks, ma'am, very much for taking me through this. I can't tell you how excited I am to actually get this vaccination. We waited. All right, well, there you have it. Time for my jab. And remember, and to remind myself, I need to take the second jab as well. And that's going to come after some time, between 4 to 8 weeks for this particular vaccine. Important to stick to that schedule to ensure that you get maximum efficacy. And that's it. Thank you very much. Didn't feel a thing.
45 डेज के बाद सेकेंड डोज लगेगी। फीवर आए तो पैरासीटामोल की दवाई लेनी है। अभी आधा घंटा बाहर बैठोगे, इसके बाद घर जाना है। मास्क का प्रयोग हमेशा करना है।
The process barely takes a minute, so this is the entire procedure. But everybody who is in Delhi and is watching this right now, please go ahead, get your jabs. You may have to wait in queue.
Right now, this is the registration checking. We have to show the Aadhaar card. And I've also given the registration number that I got when I registered for the COVID vaccination. That, of course, is essential for this to happen. It really felt like nothing. I didn't feel anything at all. Thank you. You're fantastic.
Well, I have registered myself for the first dose of COVID vaccine today in this room, and now I'm going to receive the first jab here at this hospital called SMHS Hospital in Srinagar. So here it goes like this. So all these months we have been waiting to receive the COVID vaccine. So today the age group above 45, they are receiving their first jab today. So am I. Thank you very much. I feel it so smooth, so smooth.
All right, so we certainly walked the talk. Nidhi, I can tell you that I am now almost 4 weeks after my second jab. So hopefully I will stay safe, stay secure.
Absolutely.
It's so important for people to get out there and get their vaccination. Well, someone we partnered with very, very closely at Google, Anil Ghosh, is a senior program manager. Thanks very much, Anil, for being with us. Now, Google has rolled out new features early on during the pandemic, search, assistant and maps as well, information on testing. Now, what have you sort of innovated with during the second wave when the need for credible information seems to have increased, what, 1,000-fold at least?
Yeah, first of all, thank you for having me over. It's a privilege to be here amongst you today. So our COVID-19 response efforts across our products have centered on enabling access to the latest and most authoritative information that people and communities are looking for. In building these features, we have been working very closely with authorities such as the Ministry of Health and Family Welfare, MyGov, ICMR, and several central and state authorities. At the onset of the pandemic last year, we launched a dedicated COVID-19 website and an updated search experience that presented consolidated information about top news stories, links to ministry resources, and content on statistics, symptoms, prevention, and FAQs. This resource has since evolved this year to surface timely and authoritative information on treatment, both self-care at home and medical, coping with mental health, and refreshed information on testing centers. Ever since the vaccination effort started, we built an entirely new results module for all vaccine-related information, which is today available in English and 8 Indian languages. In addition to the latest news and statistics, people across the country can easily get all details on vaccine eligibility, registration with a link to the COVID portal, nearby vaccination centers, as you already showed some time back, and common FAQs. We know users are looking for the most accurate information on the 3 approved vaccines in India. And we have summarized results for them with details about its effectiveness, side effects, safety, etc. We now have over 23,000 vaccination centers and over 2,500 testing centers across the country live on Search, Maps, and the Assistant. We continue to work with the ministry and the COVID team to map out more vaccine centers on our platforms. Across the YouTube homepage and recommendation systems, we continue to elevate authoritative videos from the ministry and MyGov and surfacing these videos on Search as well. These videos cover topics such as why you need to get vaccinated, the COVID registration process, and vaccine myths versus facts with eminent physicians like Dr. Andip Guleria, who we just heard a few minutes back. Finally, on Google Pay, we have been running a COVID aid campaign featuring 7 non-profit organizations who are doing impactful work during these times.
Bilkul. Anil, for the information on Google to have maximum traction, it needs to be available in multiple Indian languages. Beyond English and Hindi, which are the other languages we hunt for information we need on Google? You said 8. Which are these languages?
Sure. So our underlying mission at Google has always been to make information universally accessible and useful to everyone. And breaking down language barriers to make this knowledge available is a key part of how we develop our products. So much of the COVID information that we spoke about across Search, Maps, and Assistant, such as information vaccines, testing centers, vaccine centers, etc., can be accessed in English. And the 8 languages that I spoke about are Hindi, Bengali, Telugu, Tamil, Malayalam, Kannada, Gujarati, and Marathi. So today, anyone can issue a COVID-related query in any of these languages as text or using voice input, and it will trigger the various COVID experiences that we spoke about.
Because one of the things that you have worked on is on Google Maps. Once a person's location is known, with Google Maps, you can find where's the nearest vaccination center, which is a great, great help. What are the new features you're working on, just so that we can look forward to them and use them once they're ready?
Sure, Dr. Rice. So this year, during the second wave, in the past month specifically, many have had urgent requirements for medical oxygen and information on hospital beds availability. So to help them, we just launched a pilot this week in select locations where we are using the Q&A feature on Google Maps to enable people to provide information and share their local knowledge on availability of beds and medical oxygen. This information will be refreshed every 24 hours. And we are currently evaluating the effectiveness and usefulness before we decide to scale it up across India. Similarly, on Google Search, we are now showing city and state websites which are providing live information on COVID beds availability at the top of the search results, along with the authoritative medical guidance. Also, just hot off the press, if I may use that, we just went live with a new feature where users can search for COVID hospitals, specifically on Maps, Search, and the Assistant. And we are surfacing the dedicated facilities which are providing COVID treatment. As we all know, not all hospitals are actually providing treatment to COVID patients. And users on our platforms have been looking for this specific information for a while. And that's what got us to build this feature and roll it out. So it just went out. We have around 6,000 hospitals across the country mapped, and we are working to add more very soon.
All right.
Yeah.
No, sounds absolutely brilliant. There's so much out there which people can access. Is very easy to use information. Anil, thanks so much for being with us. Thanks very much indeed. We're joined now by a very special guest, Dr. Faheem Yunus, Chief of Infectious Diseases at the University of Maryland. Thanks, Dr. Yunus, for being with us. Now, you've said that while the vaccines are not 100% perfect, they are game changers that have crushed the pandemic in so many countries. Tell us how the vaccines have been able to actually achieve that.
Sure. So if you look at United States, where we started vaccinating in December, we were having about 4,000, 3,000 deaths in a day. We were having over 100,000 deaths in a month in the United States. Now that number is down to 15,000 a month, around 500 a day. And other than mass vaccination, I don't think much has changed in the United States. You see the same data from Israel, you see the same data in UK. So the point here is that at least the mRNA vaccines, Johnson & Johnson, AstraZeneca, the ones which have been used in these countries, we can say confidently that yes, these vaccines are game changers.
डॉक्टर यूनुस, हमारे यहाँ जो कोविशील्ड के दो डोजेस के बीच में जो ब्रेक है वो 12 से 16 हफ्ते कर दिया गया है, इसे आप कैसे देखते हैं?
जी, आमतौर पे वैक्सीन्स के अंदर जो गैप बढ़ाया जा रहा है डिफरेंट गवर्नमेंट्स की तरफ से, वो उसकी टिपिकल रीजन सप्लाई एंड डिमांड है। कनाडा में भी ऐसा हुआ है और कई मुल्कों में भी ऐसा हुआ है। अगर तो आपके पास एम्पल वैक्सीन हो करोड़ों की तादाद में, जो सप्लाई डिमांड से ज़्यादा हो, तो यकीनन जब ट्रायल्स में तीसरे या चौथे हफ्ते के बाद दूसरी डोज दी गई है तो शायद आप भी यही कर रहे हो। लेकिन अगर आप पास वैक्सीन कम हो तो आप उसको स्ट्रेच करने के लिए 12 हफ्ते या इवन 16 हफ्ते तक ले जाते हैं। अब जो खुशी की बात है, जो तसल्ली की बात है कि 12 हफ्ते पर भी इम्यून रिस्पांस आपका उतना ही अच्छा होता है या उससे थोड़ा सा ज़्यादा अच्छा होता है। तो आपकी पहली डोज ज़ाया नहीं हुई। फ़र्क सिर्फ ये है कि उन 12 हफ्तों में आपको बहुत एहतियात करनी है। आप अपने आप को फुल्ली वैक्सीनेटेड मत समझिए पहली डोज के बाद, लेकिन 12 हफ्ते का जो टाइम फ्रेम है वो रीजनेबल है अगर आपके पास सप्लाई कम हो तो।
Dr. Yunus, it's really great to have you with us. Everybody is worried now about the next wave, and we are all trying to vaccinate and increase the immunity levels in the population. What, in your opinion, is the percentage of population that needs to be vaccinated or have immunity to avoid a major next wave of the COVID virus?
So there is no doubt that the virus has gotten a strong foothold in many, many countries. So there is no doubt about that. Now, once the virus establishes in a community, it's not going to go away by itself. It's going to go away in two ways. One, it infects everyone, and everyone, or 80% of the people, and now they're immune to it. Or you immunize everyone, 70, 80% of the people. Those are the two broad ways. Some countries like Sweden and some like in UK as well, earlier when they wanted to go towards herd immunity, they've tried that. They've failed miserably. So the only way right now is vaccination. The point about vaccination, it's not an on-off switch that at a certain number you get to be on and at a certain number you get to be off. This is like sunrise, right? It's like a dimmer. So gradually, as you keep increasing vaccination, your number of viruses will keep going down. The risk of another wave will go down. I think somewhere around 40 to 50% will be an inflection point. Once your community reaches at vaccination of 40 to 50%, you'll probably not likely to see big waves. You may still see some endemic virus spreading. Once you get to 70 to 75%, chances are you'll be able to go back to normal.
Dr. Yunus, बहुत-बहुत शुक्रिया जुड़ने के लिए.
Well, joining us now, a very special guest, R.S. Sharma, the CEO of the National Health Authority. Thanks so much for being with us, taking some time out for us. It's always a pleasure having you explain some of the details on COVID. So this is an information campaign, and so our first question is this: can you take us through some of the key features of the app? And the question is basic, but so many more people need to be informed. So how does one register for a vaccine? Can a person choose the vaccine that they want? Can they get vaccinated without registering?
Thus far, we have vaccinated about 200 million people, and we have used COVID as a platform. Now, this platform has got four components. One is the registration and appointment component, which is basically the public-facing component where public registers, creates their account, and then they get the bookings done through the app. The second part is basically where the hospitals and these vaccination centers publish their timetables. So, for example, they will tell that this is the vaccine they are offering, Covaxin, and they will be vaccinating on these days. These are the numbers of vacancies they have with them. And if it is a paid place, they will also tell you how much money will it cost. The third component is when the vaccination event really takes place. And once it takes place, then the person who is getting the jabs, he or she basically records your vaccine, which vaccine was delivered to you, and what is the time, who vaccinated you, and your identity and eligibility verification. That is done at the vaccination point. We call it vaccination module. And the last module is actually the certificate module, which essentially, once you are vaccinated, then you are issued a certificate. So these are the four components.
एक सवाल ज़हन में ये भी आ रहा है कि हमारे ग्रामीण इलाकों में टीकाकरण अब ज़्यादा बढ़ाना है हमें, तो किस तरह से कोविन ऐप में वो एक्सेस कर सकते हैं? कोविन आपको ग्रामीण इलाकों से क्या क्या चुनौतियां सामने आ रही हैं, क्या आपको फीडबैक मिल रहा है, और अब जिस तरह से हमारे देश में टीकाकरण बढ़ेगा, कोविन पर भी दबाव बढ़ेगा, तो ज़्यादा लोग इस पर आएंगे, इस ऐप का प्रयोग करेंगे, उस लिहाज से क्या रणनीति है आपकी?
देखिए, आपका प्रश्न बहुत महत्वपूर्ण प्रश्न है ये, और इसके लिए हम लोगों ने ये कहा है कि ये ऐसा नहीं है कि ये एप्लीकेशन केवल उन लोगों के लिए है जो लोग टेक्निकली बड़े सेवी लोग हैं। वैसे तो ये है कि हमारे देश में मोबाइल कनेक्शन की संख्या 100 करोड़ के लगभग है, स्मार्टफोन भी करीब 60 करोड़ के लगभग हैं, और एक स्मार्टफोन पर आप 4 लोगों का रजिस्ट्रेशन कर सकते हैं। तो ये सिस्टम पहले से काफी इंक्लूसिव है। इसके अलावा जो हमारे सेंटर्स हैं, सारे सेंटर्स, उनमें वॉक-इन्स अलाउड है, विच मीन्स बिना रजिस्ट्रेशन के भी आप जाकर के वहां पर वैक्सीनेशन करा सकते हैं। उसके अलावा जो हमारे कॉमन सर्विस सेंटर्स हैं, जिनकी संख्या करीब 2.5 लाख के लगभग है ग्रामीण इलाकों में, उनके माध्यम से आप असिस्टेड रजिस्ट्रेशन भी करा सकते हैं। और लास्टली हमने कल शाम से, अर्थात मंगलवार से, हम लोगों ने बृहस्पतिवार से हम लोगों ने एक जो 1075 का जो कॉल सेंटर है, उस कॉल सेंटर के माध्यम से भी आप रजिस्ट्रेशन भी करा सकते हैं और बुकिंग करा सकते हैं। जहां तक स्केलेबिलिटी का प्रश्न है, तो ये काफी स्केलेबल है इस सेंस में कि 28 अप्रैल को जब ये खोला गया 18 साल के ऊपर के लोगों के लिए वैक्सीनेशन, तो हम लोगों ने 8 घंटे के अंतर्गत करीब 13.7 मिलियन अर्थात 1.37 करोड़ 1.37 करोड़ लोगों का रजिस्ट्रेशन 8 घंटे के अंदर हुआ। तो ये संभव है, इसलिए इसमें कोई परेशानी नहीं है। कुछ दिनों हमने अप्रैल में करीब 43-44 लाख वैक्सीनेशन किए थे। अभी कल ही हम लोगों ने 30 लाख से ऊपर वैक्सीनेशन किए हैं। तो वैक्सीनेशन की संख्या बढ़ती जाएगी। अब तक 20 करोड़ वैक्सीनेशन हम लोग कर सके हैं, तो इसमें कोई स्केलेबिलिटी में कोई समस्या नहीं है।
Mr. Sharma, now we noticed that COVID has introduced a search by map, and also Sputnik has made an appearance. Are there other newer features that you'll be rolling out?
Well, it is only an enabling application to ensure that the whole vaccination process is well managed, is orderly, and actually is inclusive, and we are able to know as to how many people have been vaccinated at which place. So it's actually the technology backbone. We also continue to improve the public interface, and one such interface you just now told about is the map interface which we have provided. So basically now you can search the centers as using the map, using the pin code, or using the state and the district. Similarly, what we have done now, a couple of days back, we have got out a policy, which is the Open API policy, has been published, wherein we are now allowing third-party applications to be built on top of COVID. And that basically means that people will be able to have probably better interfaces, more private sector participation will be there, and probably the state governments who have their further criteria, criteria besides age, they may also have some newer criteria. They will be able to have the jabs done. Secondly, we also have now enabled the vaccination centers in the neighborhood, vaccination centers for captive audience, which is basically the industrial houses or employees of a corporation, etc. So I think we are now sort of going out and involving more and more private sector participation, more and more customized vaccination camps, and all this is being enabled by COVID.
बहुत बहुत धन्यवाद मिस्टर शर्मा जुड़ने के लिए और बताने के लिए किस तरह से जो टीकाकरण का दायरा है अब लगातार बढ़ रहा है। अब एक और खास मेहमान हमारे साथ हैं डॉक्टर मैथ्यू वर्गीस, हेड ऑफ ऑर्थोपेडिक्स, सेंट स्टीफेंस हॉस्पिटल। डॉक्टर, मैं आपसे ये समझना चाहूँगी कि हमारे ग्रामीण इलाके जो हैं, क्योंकि अब हमें टीकाकरण बढ़ाना है, हमारे जो छोटे शहर हैं, दूर दराज के शहर हैं, ग्रामीण इलाके हैं, वहाँ पे भय देखा गया है, लोगों में हिचकिचाहट है, पढ़े लिखे लोगों में भी हिचकिचाहट है अब भी। कैसे दूर करा जाए, और जो ये आज इन्फॉर्मेशन कैंपेन हम चला रहे हैं वैक्सीनेट इंडिया, ये कितनी कारगर है उस दिशा में?
देखिए, धन्यवाद मेरे को यहाँ शो में लाने के लिए। किसी भी चीज़ की कॉन्फिडेंस तब आती है जब लोग देखते हैं कि जो भी इंफॉर्मेशन है वो सच्चा इंफॉर्मेशन है और वो पारदर्शिता के साथ आप लोगों के सामने रखते हैं। तो जो भी वैक्सीन है, हर वैक्सीन का जो फायदे हैं, कहाँ नुकसान है, कहाँ क्या हो रहा है, किस तरह से उसका अनुसंधान हुआ है, किस तरह से किस स्टेज पे उसको रोल आउट किया गया है, ये सारी पारदर्शिता के साथ आप सामने रखेंगे, लोगों का कॉन्फिडेंस बढ़ेगा। ये हमको बहकाएंगे नहीं, ये हमको बहका के वैक्सीनेशन नहीं लगाएंगे। तो केवल सच्चाई और पारदर्शिता एक ही तरीका है, एडवर्टाइजमेंट से नहीं, कैंपेन से नहीं चलेगा। आपको लोगों में विश्वास जगाना है तो सच्चाई और पारदर्शिता से ही जगा सकते।
Dr. Verghese, thank you for being with us. As you know, there's a great amount of vaccine hesitancy across the country. People are worried about having the vaccines for all kinds of wrong reasons, rumors and misinformation. How do you tackle and overcome this problem of vaccine hesitancy?
Yeah, thank you for having me on the show. It's a very valid point. How do you campaign for vaccines and convince people? People in this infodemic, there are all kinds of sources of information. You have no idea what is assimilated by someone and what is not. So we need to have a credible, honest information coming out from the government, from the ministries of health, from trusted sources, WHO, or wherever people are trusting information. It has to be honest and transparent. Unless there is transparency in all the methods employed in developing the vaccine, in research for the vaccine, in phase 1, phase 2, phase 3 trials, what were the problems that seen and what are the problems that are being overcome, where all they can use them. So if, for example, there has been confusion on the dosage intervals, first 4 weeks, then it went up to 8 weeks, then it's now coming to 8. That gives the information to the people that are in decision-making process, they themselves do not know what is right. That brings in lack of trust and confidence. You have to work with clear understanding, transparent information, shared easily and honestly with people, and then they will trust you. If they see that there is a problem which is hiding information, they won't trust you. You have to give transparent, honest information. Campaigns can go negative. If you try to campaign and do a change campaign, all kinds of problems will happen.
Dr. Verghese, you're widely seen as a hero in that whole polio drive at where everybody got together and vaccinated people to get rid of polio. And you rehabilitated so many people at St. Stephen's Hospital, polio patients. Now, polio was a disease that took years and years to be eradicated from India, but it did happen. We did win. So if we can do that, we can win against the coronavirus too and beat this COVID enemy, can't we? India can do it?
Yeah, we can do it, but there are differences. In historical terms, we took a long time to understand the polio virus, its dynamics, its epidemiology, how it spreads, and how it affects people. It took us a long time to understand. The vaccine also was in a long time to evolve. If you look back into history of polio vaccine development, it was at a very crucial point in time. In fact, at the same time as in 1952, we had people going on ventilators because of polio paralysis of respiratory muscles. The iron lung was a major thing, and vaccine was being desperately sought by people, exactly as today. So in fact, when you look at the comparisons historically, there are a lot of comparisons, of course, a lot of differences too. Here, there is a big difference. Though we know the genetics of the virus, we do not understand the dynamics of the disease process. So until we have that, we have only two methods to control it. And that is by our mask, where we now understand very clearly it's an aerosol spread. We have the mask and then the vaccine. But when there is a surge happening in the disease, your vaccine will not work. If there is a surge happening in the villages, your vaccine will not work. Like, for example, I'll just show you this graph for those people who want to see this. If you see the graph,
yeah, go ahead.
During the upswing of the curve, if you try to do a vaccination campaign, it will not work because the immunity developed from the vaccine takes about 8 to 12 weeks, 2 doses. And by that time, the surge would have finished. So don't expect surges to be controlled by vaccination. But long-term management, yes, by vaccination, but not surges by vaccination. Long-term management, once we understand, we can get a long-term effective vaccine. We still do not know because don't forget, the first vaccine rollout happened only in September, October, November, and the subsequent ones are still being rolled out. The phase 3 trials are just being completed. The results are still being viewed at. We don't know the long-term effect. We still do not know 6 months down the line will it still be effective. We have no clarity on these things. Until we have clarity on these things, we have to work on two fronts. If it is a surge, it's only the mask that is going to help us. If it is, and the other sanitization that is going to help us. If it is not a surge, yes, vaccination should be rolled out to as many as possible with a caveat. Don't think if you're vaccinated, you can forego the masking and you can forego the protection that we need to have for others. Both are equally important until we understand the dynamics of the virus clearly.
बहुत बहुत धन्यवाद डॉक्टर मैथ्यू वर्गीज। ये कहने के लिए वाकई समझना ज़रूरी है कि आप दोनों अगर डोज लगा लें वैक्सीन के भी, तब भी अपना मास्क ज़रूर पहनना है। बहुत बहुत धन्यवाद जुड़ने के लिए।
धन्यवाद।
तो कोविड के दौरान डॉक्टर्स, हमारे फ्रंटलाइन वॉरियर्स जो हैं, मरीज़ों के इलाज में कसर उन्होंने बिल्कुल नहीं छोड़ी है। ज़्यादातर की कोशिश रही है कि मरीज़ ठीक होकर घर जाएँ। इनकी भी गुजारिश है कि ज़्यादा से ज़्यादा लोग टीका ज़रूर लगवाएं ताकि कोरोना से बचें और अगर संक्रमण हो भी जाए तो घातक असर ना हो।
नमस्कार, मी मराठी माणूस असून माझे सर्व मराठी बंधू बहिणींना विनंती करतोय की सर्वांनी वॅक्सिनेशन घ्यावे, कारण वॅक्सिनेशन घेतल्यानंतर कोविडचा आजारपण एकदम सिव्हिअर होत नाही आणि जीव वाचू शकतो, स्वतःचा पण आणि दुसऱ्यांचा पण।
আপোনালোকৰ মনত নিশ্চয় আমনি কৰি থকা প্ৰশ্নটো হ'ল এই কোভিডৰ মহামাৰী কেতিয়া শেষ হ'ব, মানুহৰ জীৱন কেতিয়া সুৰক্ষিত হ'ব। এই মহামাৰী তেতিয়া শেষ হ'ব যেতিয়া আপোনালোকে নিজৰ পৰিয়ালক কোভিডৰ টিকাকৰণ কৰিব আৰু লগতে চুবুৰীয়াক এই বিষয়ে সজাগ কৰিব।
ഇതുവരെ 500-ലധികം ഗുരുതരാവസ്ഥയിലുള്ള കോവിഡ് രോഗികളെ ICUവിലും അതേപോലെ 2000-ഓളം ഓക്സിജൻ ആവശ്യം വരുന്ന കോവിഡ് രോഗികളെയും ഞാൻ ചികിത്സിച്ചിട്ടുണ്ട്. ഇതിൽ ഒറ്റ രോഗി പോലും കോവിഡ് വാക്സിൻ സ്വീകരിച്ച രോഗി ഉണ്ടായിരുന്നില്ല. അതുകൊണ്ട് തന്നെ നമ്മൾ ഓരോരുത്തരും എത്രയും പെട്ടെന്ന് ഈ വാക്സിൻ സ്വീകരിച്ച് ഈ ഒരു മഹാമാരിയിൽ നിന്ന് സ്വയം രക്ഷ നേടണമെന്ന് ഞാൻ അഭ്യർത്ഥിക്കുകയാണ്.
ಕೊರೋನಾ ಹರಡುವುದನ್ನು ತಡೆಗಟ್ಟಲಿಕ್ಕೆ ವ್ಯಾಕ್ಸಿನೇಷನ್ ಮತ್ತು ಕೊರೋನಾ ಅಪ್ರೋಪ್ರಿಯೇಟ್ ಬಿಹೇವಿಯರೇ ಮೇನು ನಮ್ಮ ಹತ್ರ ಇರುವ ಆರ್ಮ್ಸ್. ಆದಷ್ಟು ಬೇಗ ನೀವು ವ್ಯಾಕ್ಸಿನೇಷನ್ ಮಾಡಿಸ್ಕೊಂಡು ನಿಮ್ಮನ್ನು ನೀವು ಉಳಿಸ್ಕೊಳ್ಳಿ ಹಾಗೂ ನಮ್ಮ ಸೊಸೈಟಿಯನ್ನು ಉಳಿಸಿ.
ਸਾਡੇ ਨਾਲੇ ਦੁਆਲੇ ਜਿੰਨੇ ਵੀ ਸਟੇਟਸ ਨੇ ਉਹਨਾਂ ਵਿੱਚ ਵੈਕਸੀਨੇਸ਼ਨ ਦੀ ਇੱਕ ਮੁਹਿੰਮ ਚੱਲੀ ਹੋਈ ਹੈ ਤੇ ਅਸਾਂ ਸਾਰਿਆਂ ਨੂੰ ਇਹਦੇ ਵਿੱਚ ਪਾਰਟਿਸਿਪੇਟ ਕਰਨਾ ਚਾਹੀਦਾ ਹੈਗਾ, ਕਿਉਂਕਿ ਵੈਕਸੀਨ ਲਗਾਉਣ ਤੋਂ ਹੀ ਇਹ ਜਿਹੜਾ ਕੋਵਿਡ ਹੈਗਾ ਇਹਦੇ ਬਾਰੇ ਇਹਦੇ ਅਗੇਂਸਟ ਸਾਨੂੰ ਬਚਾਅ ਹੋ ਸਕਦਾ ਹੈ.
Nidhi and Vishnu, I just want to return to those graphics again that are prepared by our team because I feel they're so important in understanding why we need vaccinations. I'll go very quickly through. If you look at the top 30 countries of the world that have faced COVID, the time difference between the first phase and the second phase is about 5.5 months on average. And the second phase is always much worse than the first phase. In fact, it's 75% worse. And in India, how does that compare with the global picture? In India, the second phase was much worse than the global average. It was 320% worse in India than the first phase. 320% higher cases. And in fact, that makes India the worst in the world when it came to the second phase. Look at that. India, 320%. Second was America with 295%. Indonesia, 200. Russia, 150. And Argentina with 115% more. So average for the world, 75% higher number of cases than the first wave. So what we really need to do is to raise the immunity level in our population. What is the immunity level so far? First of all, those who had a vaccination already, both doses, is 3.4%. And people who have already had COVID, 2%. So about only 5.4% of our population is immune at the moment. Now, if we continue to vaccinate at the current rate of 2 million a day, by December, we will hit 21% of our population vaccinated. That's very low. But if we step it up, say in August, in a couple of months' time, to 6 million vaccines a day, it will go up to 43% immunity in December. But if we hit our dream target of 9 million vaccines a day, August onwards, we will have an immunity level in our country of 60%. Now, what will be the impact of that on the next wave? First of all, if we have no vaccination, the next wave will have more than 1 million to 1.5 million cases per day at its peak. That is unforgivable. If we vaccinate at only 2 million a day, it will come down a little bit, but still be very bad. If we vaccinate at 6 million a day from August onwards, you will come down sharply and have a very, very weak next surge. It will be much better. And finally, if you vaccinate at 9 million a day, you will have no third wave in India. Wonderful. Vishnu and Nidhi, that's the point we want to make, that the team has brought out. The relationship with the vaccination, the speed of vaccination, and getting rid of that third wave. We can get rid of that third wave and not have one at all.
Absolutely. Just have to step up that pace of vaccination. Joining us now, Dr. Naresh Trehan, Chairman of the CII's Healthcare Council, Chairman and Managing Director, Medanta, the Medicity. Thanks very much, Dr. Trehan, for being with us. Now, treatment protocols are constantly evolving and changing. I mean, you're learning, literally on the fly. And the latest weapon is an antibody cocktail. It's met with some success at Medanta. Tell us a little bit about that.
So there are two antibodies made in the lab, casirivimab and imdevimab. These are specifically designed to actually block the virus COVID-19 from entering the cell of the patient who's been infected, so that they cannot draw energy from the cells to replicate or multiply. If that happens, then they will gradually wither away without multiplying. So this is a very effective weapon against infections which are caught within the first 7 days. So if you saw, President Trump was first admitted to Bethesda when he got infected. He got this cocktail, and then he went home 2 days later and went down to the White House to work. So right now, it is very clear that when people get infected and they test positive, if within the first 72, 48, 72 hours or 3-4 days later, the sooner the better. If you give this cocktail, you can block the virus from multiplying. What the end result of this is, which is proven by many, many studies around the world, is that if you estimate people who are at a high risk of getting admitted to a hospital, 78 to 80% of those people will not need hospitalization.
Right.
Also, the death benefit, if you got admitted and you got serious and you had the possibility of dying, then 70% of the people can be saved from dying. So this is quite an effective weapon. Now, we wish it had come to India 2 months ago. We would have avoided many, many deaths and many, many hospitalizations. But however, it's arrived now. We started using it on Wednesday, and people are coming as they get tested. They come and get their dose. And so far, all of them are at home, and we are following them very closely.
निधि
बिल्कुल हमारे साथ डॉक्टर सुनीला गर्ग हैं, डायरेक्टर एंड प्रोफेसर हेड कम्युनिटी मेडिसिन मौलाना आजाद मेडिकल कॉलेज और मेंबर हैं द लैंसेट कोविड-19 कमीशन. Ma'am, I'd like to understand what are the symptoms of COVID caused by this new variant and how do they differ? जो हमारी पहली वेव आई थी, infections हुए थे उस दौरान, उससे कैसा अलग है ये?
See, basically the variants which have come, number one, the infectivity is much more. That means, the persons, if earlier, you could see one person in the family, now you can see whole families being affected. So one person can affect many persons. So, our R naught, that means the number of persons who can infect more has gone up. So, number one, that is an important question, that this is much more infective. But we are also observing that these variants are also more severe in nature, particularly when we are talking of double mutant strains and all, they are more severe, and that's how we are seeing more and more mortality as well. But otherwise, you see, when we see from the question of, initially when we saw the UK strain, when we saw, the other strains, Brazil strain and African strain, out of which most of the cases were of the UK strain. So we saw that was much more infective. But when we are seeing now double mutant strains, so these are infective as well as they cause more mortality. That is important part which you have to remember.
Dr. Garg, as a global specialist in community medicine, how do you actually teach, say, a community that really doesn't understand the details and the intricacies of the coronavirus and how to behave? How do you get it across to them? Sometimes it's too late before they really understand the threat that it poses, right?
See, it's a very, very important question what you asked, that basically, working with the communities is definitely, we have to work with the communities and know exactly what kind of communities we are working with. We are working with urban communities, rural communities, and urban tribal communities as well. So you have to begin with from where the communities are. And accordingly, like suppose we are talking about COVID-19, so we have to sensitize them that this is the kind of infection, which we have got, which has got, higher amount of infectivity. And then, again, we tell them about, the signs and symptoms of the disease. But most important point is also the preventive part is
Doctor, let me just ask you this. How do you convince people to test? Now, we've all seen images and videos of people arriving at bus stations and railway stations and rushing to get away from compulsory testing. How do we convince people that they should find their nearest testing centers and get themselves tested, because it is so critically important?
Yeah.
Did you get that question?
Definitely, it's one of
Yeah,
the
go ahead.
most important questions, that how do we get the people to get tested? Because there are a lot of, initially there was a lot of stigma and discrimination which was associated with testing. That means they were isolated, from the, there was a plate which was put outside the house. And the second thing, so healthcare providers, when they went home, so they were also discriminated. So a common man thought, basically that, if we are going to get tested, so these are the things, we are going to be discriminated. So one starts working on this scenario and tells them that if you are detected early, so the treatment can start early. Whether we can, and even we focus a lot on home isolation as well, because what we have realized is that ultimately home isolation will play a very, very critical role, and simultaneously it will also, a lot of stigma and discrimination. And plus, health said, feels even isolated. That's why we were just last week in rural areas, and what we realized is at this age, we have to focus upon them, and we have to see that, they must come forward. And for rural areas, I don't see it as a check. That is where our system is very well organized. We have got 2 workers for the population which is already enlisted under Ayushman Bharat. So they can be, all be those who are symptomatic, and there we are going from house to house to do their samples also collected. And also there the panchayats have got a very, very critical role to play, because, we are focusing upon also, the village volunteers and all who will come forward, and people who have
Well,
recovered
Dr.
also
Garg,
from
is
COVID.
so
They're
very
going to play-
important, people out there in villages, and that's such an important point that you make, ma'am. Well, joining us now, Eric Fiegelding. He's a senior fellow at the Federation of American Scientists. Dr. Fiegelding, good to have you back on an NDTV program. Now, we are still very much locked down in many parts of India, but there are some preparations now underway for a third wave of COVID in India. Do you think we'll necessarily see this in our country?
I think everything is possible. We thought that we had seen a wave last spring in many countries and thought that was it. And in the summer, some places got another wave. Some places in the fall started getting another wave. And some places in the winter, another wave. And of course, now we have many, many variants. If there can be a British variant, an Indian variant, a Californian variant, New York variant, South Africa variant, there can be much, much more, many more variants that develop in the future. And the world is not nearly vaccinated enough that we have enough protection. So I think we really need to focus on how can we suppress and stop this everywhere, because any country on earth that is still vulnerable means the virus can continue to mutate and threaten the rest of the world again.
So talking about future variants, how deep are your concerns and your worries of future mutations of the coronavirus? And what does that mean for vaccination? Does it mean that we should really vaccinate quickly so mutations don't arise? Or do vaccines themselves have to keep changing?
Yeah, absolutely. Vaccinating is the fastest way to prevent another wave. Vaccinating, that said, can't stop an immediate wave, but it can slow in the near future and prevent another one. And of course, vaccination, we have to be very strategic. How can we maximize it? But we know that one dose is not enough for the B1617.2 variant, because this B1617.2 variant, according to the latest data from UK, the vaccine only has 33% efficacy with just one shot. And with 2 shots, the AstraZeneca Covishield only has about 60% efficacy. Pfizer has about 88% efficacy, but that's still, AstraZeneca Covishield is the main vaccine. So, and one dose clearly is not sufficient. 33% is not a good amount of protection to really, really slow the virus that much.
That was going to be my next question about the real world efficacy data that we have so far about the vaccines and how effective they've been against variants. So what do we now know about effectiveness, efficacy?
In general, vaccines are very good against most of the coronavirus variants. However, there are exceptions. The South Africa variant, B1351, is very problematic. South Africa has now stopped using it because its 22% efficacy wasn't even significant. And that's for 2 doses. Now, for the B1617-2, 33% with 1 dose, again, worrisome. 60% is good, but these are also, remember, these are symptomatic. Symptomatic efficacy is higher than asymptomatic. Asymptomatic oftentimes is even less, although for severe disease, it's usually much higher, around 90 to 100%. So it will prevent you from going to hospital, but it does not stop all transmission. And so even though you may be vaccinated and you may be relatively healthy with a vaccine, you can still potentially transmit it to someone else. One of the 9 out of 10 people in India who still has not gotten vaccinated. So vaccines play a critical role, but you need 2 shots, and you need to combine vaccinations with many other mitigations when it comes to these variants especially.
Thank you so much, Dr. Eric, for joining and taking out time. Thank you so much. तो हमारे देश में सबको टीका लगे, ज़रूरी है कि सभी इलाकों, सभी वर्गों तक ये टीका कैंप्स पहुँचे। अब एक वैक्सीनेशन कैंप स्पेशल नीड्स के लोगों के लिए भी लगाया गया है।
My son Akhilesh is a special needs child, so it was difficult. It's difficult to get them. I was just wondering, how to get him vaccinated, because he cannot go in crowds, and he finds it difficult, to communicate.
This vaccination camp, organized by a mall in Gurugram, is exactly what Radhika Srinivasan needed to get her son, who has special needs, vaccinated. Organized in conjunction with the district administration and NGOs, the logistics were kept as simple and non-disruptive as possible.
We have gate number 5. The car comes there and is parked there only. We have enough parking space. And there's a minimum walking distance. And we have different slots of waiting, about 100 slots, so they can wait there, get themselves registered, and then go for a vaccination inside the room.
Right.
And then when they are vaccinated, we have some sitting area where they are made to sit down for half an hour, because that's a protocol by the government. We gave them small refreshments, and then they go away.
Right. There were 100 walk-in slots with recipients being administered their first dose of Covaxin.
Children with special needs, they are really vulnerable to all the infections. Their immunity system is so weak. And we were afraid of going to a normal camp where there's so much of queue and we have to wait. So this thing done in a matter of minutes. I came here and it was so smooth and so clean, so hygienic.
This camp for vaccinating special needs adults is only a start, and many more such efforts will go a long way in ensuring that all of India is vaccinated.
और अब हमारे साथ बेहद खास मेहमान है छत्तीसगढ़ के स्वास्थ्य मंत्री टी.एस. सिंहदेव हैं। बहुत बहुत धन्यवाद सर टाइम निकालने के लिए। सर, पहला सवाल यही है कि आपने तो ट्वीट करके कहा है कि छत्तीसगढ़ सबसे आगे रहा है, अग्रणी राज्यों में रहा है, 45 पार के ऊपर जो लोग हैं उनको टीका देने के लिए। किस तरह से ये हासिल किया गया?
इसमें जो प्रोटोकॉल आया था गवर्नमेंट ऑफ इंडिया से कि हमको वैक्सीनेशन साइट्स चिन्हांकित करनी है, हम पल्स पोलियो या पोलियो के टीके लगाते हैं, ड्रॉप्स देते हैं, तो कैसे उसके लॉजिस्टिक्स को बनाया जाता है, एक सेंट्रल गोडाउन से सब गोडाउन और सब गोडाउन से ड्रॉप के सेंटर्स कैसे हम ले जाते हैं, तो वही पैटर्न था। इसमें हम लोगों ने 3,349 वैक्सीनेशन साइट्स चिन्हांकित किए, 20,000 हमारे गांव हैं, तो 3,349 में 5 स्टाफ को ट्रेन किया जो वैक्सीनेट करेंगी, सिस्टर्स हैं, एक वैक्सीनेशन ऑफिसर रहेंगे जो ओवरसी करेंगे, एक रजिस्ट्रेशन के लिए व्यक्ति रहेंगे, तो 5 लोगों की टीम जो रजिस्टर करेगी टीका लगाएगी और ओवरऑल प्रबंधन करेगी। 4 कमरे बनाने, ये प्रोटोकॉल आया था, क्लियरली लेड आउट। उस हिसाब से ये तैयारी थी। 7,000 लोगों को ट्रेन किया था जो टीके लगाएंगे, और हमारी क्षमता एक दिन में 3.5 से 4 लाख टीका लगाने की बनी हुई है। अभी तक मैक्सिमम जो हमने अचीव किया 3,26,020 टीके एक दिन में हमने लगाए थे, तो 3 से 3.5 लाख टीके छत्तीसगढ़ लगा सकता है।
जी, छत्तीसगढ़ में एक बड़ी आबादी आदिवासियों की भी है और कई रिपोर्ट्स आई हैं अन्य राज्यों से आई हैं कि उनमें डर भी है, हिचकिचाहट है वैक्सीन लगाने के लिए, टीकाकरण के लिए। तो क्या कुछ रणनीति या प्लान है कि किस तरह से उनको समझाया जाए, उनके अंदर विश्वास जगाया जाए इस टीकाकरण के लिए?
एक, उनको पुश ना किया जाए। अगर आप दबाव बनाएंगे तो वो और दूर जाएंगे उनके ऊपर। अगर किसी प्रकार से ऐसा रहेगा नहीं आपको लेना ही है, तो आप अगर याद करेंगे, आपके समय का भी वो बात होगा, 70s के दशक में जब एक अच्छे कार्यक्रम के लिए दबाव बनाया गया था नसबंदी के लिए, फैमिली प्लानिंग के लिए, तो आप देखें कि कितना उसका रिएक्शन हुआ था। यहाँ तक कि उस समय की जो गवर्नमेंट थी वो भी वोट आउट हो गई थी। तो लोगों पे दबाव बना के अगर आप काम करेंगे तो आपको सफलता नहीं मिलेगी, बल्कि लोग और रिएक्ट करते हैं। तो उनका विश्वास लेना, देखा देखी जिसको हम लोग यहाँ की चलन की भाषा में कहते हैं कि एक दूसरे को देख के कि उनने लगाया, कोई चिंता की बात नहीं है तो हम भी लगा लेते हैं। 77% 45 ईयर्स एंड अबव, इनको 77% कवर कर लिया है छत्तीसगढ़ ने। तो मुझे लगता है कि इसको देख के ये धीरे धीरे हम लोग, अगला टारगेट स्वाभाविक है कि 80-85%, 90%, 90% क्रॉस करके और फिर सेकेंड डोज उनको दिलाना। आप जितना दबाव बनाएंगे उतना लोग आपसे दूर जाएंगे। उनके पास जाके उनको समझा के और ये कह के कि आप देखिए दूसरी तरफ भी क्या हो रहा है, समाज के प्रमुख लोग हैं, जनप्रतिनिधि हैं, धार्मिक गुरु हैं, अधिकारी हैं, ये सब मिलके हम लोग प्रयास कर रहे हैं कि टीकाकरण अधिक से अधिक लोगों को लग जाए। चाहे वो दूर दराज के गांव हो जहां मलेरिया की भी जांच होती है, जहां बीसीजी के भी टीके लगते हैं, जहां पोलियो ड्रॉप्स भी पहुंचते हैं, आखिरी गांव तक ये सारे इलाज पहुंचते हैं। तो स्वास्थ्य विभाग का अमला आखिरी गांव तक पहुंच सकता है।
Mr. Singhdev, one of the things you've done, which is a double-edged sword, you've made it much easier, more accessible to get vaccinated. You can just you can have walk-in vaccinations in Chhattisgarh. But the worry is that if there's a little bit of a short supply, there'll be long queues and that people may get infected while they're queuing up to get a vaccine. How's it worked out in practice? It's a great idea that you don't have to register, you don't need good Wi-Fi, etc. That you can just walk in and get a vaccination. But is there a worry that you could contract COVID while waiting, queuing up for a vaccination?
It is certainly a worry. It is a worry for vaccination. It is a worry during testing. We try to keep it in mind, try and see people come masks, try and see they keep distancing. And there is a limitation in the sense that if only 100 or 120 people can be vaccinated in a day, then if more people than that have come, we ask them to come the next time. And it is not only on-site registration, it is both. We have online registration as well as on-site registration, particularly on-site for those distant areas where people may not be having or will not be having Android phones, or the connectivity is very poor. So it is a joint platform of online as well as on-site registration.
All right, Mr. Singhdev, thanks so much for sharing your thoughts with us and what you've done in Chhattisgarh. Thanks so much indeed. What we'd like to now do is actually a segment with some specifics on treating COVID and some of the myths versus the facts. Joining us now, Dr. Sumit Ray. Dr. Ray, can steroids be used to treat COVID or should they be avoided?
See, that's a question that cannot be answered in just one simple. Steroids are necessary for a subset of patients of COVID. It should be used in those patients who are on oxygen, on the ventilator, different doses, different time points. If we use, and that's true of any medication, not just in COVID, for any medication in medicine and critical care medicine particularly, is that the medicine has to be given at the right time to the right patients subset of patients, and the timing is important. The disease process of COVID is such that initially there is the viral infection, the virus is in the body, and the inflammatory response that the body puts up to fight that infection is a necessary evil. It's only when the virus is about to go out and the inflammation in the body persists, that's where the steroids come in.
All right, now we have with us a list of questions that have the maximum number of opinions at the moment, and we're looking at separating misconception from fact. Now, the first one you've answered: can steroids be used to treat COVID or not? Another worry or misconception has to do with plasma therapy and the fact that it now seems to be ineffective and dropped from the COVID treatment protocol. So tell us a little bit about that.
So plasma therapy came in initially in the beginning of the pandemic with a few observational trials which were done. But all the major trials which were done well, randomized controlled trial, large studies showed that there was no benefit of plasma. And it has been true for a long, long time. Even the study done in India, the plasmid trial also showed, also showed that there was no advantage of giving plasma. It did not improve survival or in any way improve outcomes in patients of COVID. Having said that, is there a potential for a very small subset of elderly patients with low antibodies where plasma could be used? Maybe, maybe not. But at the present moment, the evidence is against the use of plasma, and that has been true for a long, long time. And it has been unfortunate that a lot of patients, families, and loved ones have been running around trying to get plasma, but yet it had been proven that it was not of great benefit.
डॉक्टर सुमित, अब एक नई दवाई आई है 2DG और कहा जा रहा है कि ये काफ़ी इफेक्टिव है ट्रीटमेंट कोविड के लिए। आपका क्या आकलन है इसके बारे में?
देखिए, अभी भी इस ट्रीटमेंट का कोई स्टडी, वेल पब्लिश स्टडी नहीं आया है। ये प्रेस रिलीज के द्वारा रिलीज किया गया है। आई थिंक साइंस प्रेस रिलीज के द्वारा नहीं होता है, ये स्टडीज के बेसिस पे होता है, पब्लिश स्टडीज के बेसिस पे होता है। ये यदि पैंडेमिक के शुरुआत में हुआ होता है कि आप प्रेस रिलीज से रिलीज कर रहे हैं, वो दूसरी बात है। पर अब जैसे बड़े सारे कंट्रीज ने बहुत बड़े बड़े प्लेटफॉर्म्स बनाए हैं रिसर्च के लिए, जैसे रिकवरी, सॉलिडारिटी एटसेट्रा, तो बड़े ट्रायल्स हो चुके हैं कि कौन सा ट्रीटमेंट काम करता है। और इस सिचुएशन में आप बिना कोई स्टडी पब्लिश किए, सिर्फ बेसिस ऑफ अ प्रेस रिलीज, उसका डेटा पीयर रिव्यू नहीं हुआ, वो डेटा पब्लिक डोमेन, साइंटिफिक डोमेन में नहीं आया, उसको आप क्लेम करना कि काम करता है, इज नॉट अप्रोप्रिएट वे टू गो अबाउट इट। हो सकता है कि आगे चल के बड़ा स्टडी हो और वो दिखाए कोई रेस्पॉन्स, पर जब तक वो नहीं होता, ये अनसाइंटिफिक होगा कहना कि ये काम करता है।
That's very interesting. There's also this misconceptions and confusion about many of the drugs that are being used for COVID. For example, remdesivir. Now they say that it's actually not really effective. But others say, look, it's worth trying in certain situations. What's your final view on this? Yes or no to remdesivir? And name a couple of other drugs too, where there is a kind of a debate on.
See, that's the thing, Dr. Roy, is that in medicine there are no absolute yes or no answers. There are certain studies. There is no magic bullet for any critical illness or severe illness, and that is true of COVID too. And the most important thing is which subset of patients it will work in, and in which setting, which phase of the disease process. So remdesivir is an antiviral. If it works, it will work in the early phase of the disease. But what the studies have shown that it just reduces the length of hospitalization in a small subset of patients who have been on oxygen, minimum amounts of oxygen. Those who do not require oxygen, or those who are more sick, who are on ventilators or high oxygen requirements, do not benefit. Overall, there is no improvement in survival. It is not a life-saving drug for sure. That is for sure. Does it reduce the length of stay in a small subset of patients? Yes, it may.
डॉक्टर सुमित, एक सवाल भी है आया है कि जो पेशेंट कोरोना से उबर रहा है, ठीक हो रहा है, क्या सबको म्यूकोरमाइकोसिस या फिर कोई ऐसा ही अदर फंगल इन्फेक्शन हो सकता है?
नहीं, ऐसा नहीं है। म्यूकोरमाइकोसिस एक बहुत ही स्मॉल सबसेट ऑफ पेशेंट्स में होता है, जिनमें जो प्राइमरीली जो डायबिटिक्स हैं, अनकंट्रोल्ड डायबिटीज है, शुगर कंट्रोल में नहीं रहा है, हाई स्टेरॉइड डोजेस मिले हैं क्योंकि डिजीज प्रोसेस को सप्रेस करना है, या बहुत प्रोलॉन्ग स्टेरॉइड थेरेपी मिला है, उस सबसेट में और एक दो चीजें उसके साथ एडेड सिचुएशंस में हो सकती है। 99.9% ऑफ पेशेंट जो कोविड से उभरे हैं और ठीक हुए हैं, उनको म्यूकर नहीं होगा।
Dr. Ray, I just wanted to wrap up this segment by asking you, how hard has it been for you as doctors to counter all of this misinformation swirling around? You're fighting the disease. You also have to, unfortunately, end up fighting misinformation.
Right. Unfortunately, it has exposed two things. One is that basically if there is too much information without context, because medicine has to be it has to be learned over a period of time with a process, and you have to contextualize information. If that is not done, then this infodemic spreads and it causes more harm. People who do not realize the context of a therapy try to give or push that therapy down. Second thing that it has exposed is that even our own doctors' community's ability to analyze data, analyze studies, and look at which are the important studies to look at and use those medications in the appropriate way that has to be done. Rather than looking at WhatsApp messages, some vague study which has been produced at some vague place and is being circulated. So the ability to analyze these studies should be part of our medical education also, understanding those and which to choose and which not to choose. And also one has to understand the context. As a citizen of the country, I may be interested in economics, but can I make economic decisions? Is this stagflation at this point of time, and is there a need for cash injection into the system or not? I can have my opinion, but I cannot be the one determining how it goes. Like economics in medicine, it has to have a context when we talk about medication, what time, what duration, which patient, which subset, at what, for what time duration.
डॉक्टर सुमित, बहुत बहुत शुक्रिया। और कई भ्रांतियां थी, उनमें आपने हमें तथ्य जो है हमारे सामने रखा। बहुत बहुत धन्यवाद इसके लिए, बहुत बहुत धन्यवाद। और अब एक बड़ी अच्छी खबर यही है कि अब जो हमारे युवा हैं स्वागत कर रहे हैं टीकाकरण का, और बड़ी तादाद में निकल कर आए हैं, उन्होंने टीका लगवाया है, उनके अनुभव वो साझा किए। आइए आपको ये रिपोर्ट दिखाते हैं।
I got myself vaccinated just a few days ago, and as a youth of this new India, I would like to urge each and every youth falling in the age category of 18 to 44 years to come forward and get vaccinated at the earliest. Last request is that despite getting vaccinated, you all should maintain the appropriate behavior related to COVID protocols like wearing masks, sanitizing hands, and maintaining social distancing whenever you go out. And please, 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 it's my request that you all should go out of your house only when it is necessary or in some kind of emergency.
I feel good that even now in this case we are getting vaccinated, so I feel pretty good. Yeah.
I got my first dose of Covishield in March and it was easy breezy. I got a mild fever and fatigue for a day, but then since then it's been pretty good. I have not got any other symptoms. I would urge everybody to go get vaccinated, be it Covishield or Covaxin. Just go get vaccinated, wear a mask, use a sanitizer, wash your hands and stay safe.
Well, joining us now, a very special guest, Dr. Arvind Soin. He's the chairperson of the Medanta Liver Transplant Institute. Thanks very much for being with us. Now, Dr. Soin, does COVID affect those on medication for chronic liver conditions or those who've had transplants any differently? Are they at a higher risk?
So it's pretty clear that COVID actually affects patients with liver disease much more than patients who do not have it. Now, what's happening is there are the same receptors in the liver that there are in the lungs to which the virus attaches. But if the person is normal with normal liver function, then they will not be affected. The liver tests may go up a little bit, but nothing much is going to happen to them. The liver test will settle down in a couple of weeks, which means the bilirubin and the transaminases will settle down. But if they already have liver disease, and if that's mild, then the liver disease can become severe with COVID infection. And if they already have severe liver disease, then there is a 15 to 20% chance of dying if a person with severe liver disease gets COVID. Now, in fact, I have been telling patients who have bad liver disease and who are basically waiting for a liver transplant over the last 1 year or so, I've been telling them that it's safer to go ahead and have a transplant so that they no longer have that comorbidity or organ failure. Because patients after a successful transplant have less of a risk compared to if they have severe liver disease. But for a normal person, COVID doesn't do much to the liver.
Dr. Soin, good to see you back in action after going through a bout of COVID, even though it was mild because you were vaccinated actually. But good to have you back 100%. You're one of India's leading liver specialists. Now, when people have severe liver conditions, they may be on immunosuppressants and all kinds of other drugs. Is it still safe for somebody with severe liver disease to be vaccinated? Is it safe for them?
Yes, Dr. Roy, absolutely. A person with liver disease must get vaccinated because he is at a higher risk of getting severe COVID. And like I said, in fact, the more severe the liver disease, the more the risk of the COVID actually killing that person. So yes, if the vaccine is available, then all patients with liver disease must go for it. I've advised all my patients to have it over the past year, ever since the vaccination opened up. And that's a myth or misconception that must be dismissed. If you have liver disease, you must go for vaccination. It's not like you can't go for it or something will happen or you'll react badly. Those are common myths and misconceptions that must be dispelled.
डॉक्टर सोइन, जो लोग जिनको लिवर की बीमारी है, इस दौरान कैसे अपना ध्यान रख सकते हैं?
देखिए, जिनको लिवर की बीमारी है, वो लिवर का ट्रीटमेंट जैसे पहले कर रहे थे वैसे ही उनको करना है। और कोविड अप्रोप्रिएट बिहेवियर जिसको हम बोलते हैं कि अपने हाथ साफ रखने हैं, सैनिटाइजर यूज करना है, मास्क यूज करना है, सोशल डिस्टेंसिंग करना है, तो वो प्रिकॉशंस सब लोगों के लिए सेम है, चाहे किसी को लिवर डिजीज है चाहे नहीं है। और जिनको लिवर डिजीज है वो लिवर का जो ट्रीटमेंट ले रहे हैं तो उनको वो लेते रहना चाहिए। और जिनको लिवर डिजीज सिवियर है वो फ्रीक्वेंटली अपने लिवर स्पेशलिस्ट से मिलें। और जहां तक न्यूट्रिशन का सवाल है, जिनको सीरियस लिवर डिजीज होती है उनको कम नमक वाला खाना खाना चाहिए और उसके अंदर ऑयली और फैटी फूड कम होना चाहिए, प्रोसेस्ड फूड, सिंथेटिक फूड कम होना चाहिए, फ्रूट्स एंड वेजिटेबल्स अच्छे हैं, ऑलिव ऑयल अच्छा है, कोकोनट ऑयल अच्छा है और फाइबर लेना चाहिए और ऑफ कोर्स अल्कोहल का सेवन नहीं करना चाहिए। तो ये कुछ प्रिकॉशंस हैं जो पेशेंट्स लिवर डिजीज वाले हैं उनको लेना चाहिए। और जिनको लिवर डिजीज और डायबिटीज दोनों है या उनके लिपिड्स में खराबी है तो उनको अपनी डायबिटीज कंट्रोल करना चाहिए और लिपिड्स को कंट्रोल करना चाहिए।
बिल्कुल, बहुत बहुत धन्यवाद इस अहम जानकारी के लिए और सुझाव के लिए। बहुत फ़ायदा होगा आपको सुनकर लोगों का। और अब हमारे साथ बेहद खास मेहमान है डॉक्टर अमरीश मित्तल, चेयरमैन एंड हेड ऑफ एंडोक्रिनोलॉजी एंड डायबिटीज़ एट मैक्स हेल्थ केयर, पैनमैक्स साकेत। डॉक्टर मित्तल, जो एक बड़ा कंसर्न हमारे देश में डायबिटीज़ को लेकर भी है, कई लोग इससे संक्रमित हैं जिनको कोविड भी हुआ है, तो ऐसे में कैसे ध्यान वो अपना रखें, क्या क्या एहतियात बरतें?
डायबिटीज़ और कोविड का बहुत इम्पोर्टेंट रिश्ता है, बहुत अंतरंग रिश्ता है, क्योंकि इंडिया में डायबिटीज़ ज़्यादा है और कोविड उनको ज़्यादा असर करता है जिनको डायबिटीज़ है, इसलिए हमको अपना विशेष ख्याल रखना ज़रूरी है। अगर आपको डायबिटीज़ है तो ये ज़रूरी नहीं कि आपका कोविड होने का चांस या कोविड इन्फेक्शन का चांस ज़्यादा हो, लेकिन अगर आपको डायबिटीज़ है और कोविड आपको संक्रमित करता है तो आपका खराब आउटकम होने का चांस ज़्यादा है। मतलब अगर आपको कोविड हो गया और डायबिटीज है तो ये चांस ज्यादा है कि आपको आईसीयू केयर या ऑक्सीजन की आवश्यकता हो। लेकिन ये इसमें जानना जरूरी है कि सब डायबिटीज एक नहीं होती। अगर हमें माइल्ड डायबिटीज है, शॉर्ट ड्यूरेशन की है, साथ में ब्लड प्रेशर, हार्ट डिजीज नहीं है, यंग एज है, तो हमारी डायबिटीज हमें कोविड हमें इतना कोई अधिक नुकसान नहीं पहुंचाएगा। अगर हमारे खुद के शोध ने यह दिखाया है कि अगर हमें डायबिटीज के साथ ब्लड प्रेशर और हार्ट डिजीज और किडनी डिजीज, जितने जितने कोमॉर्बिडिटीज हम लोग बोलते हैं, ये बढ़ती जाती हैं, उसी हिसाब से उनका आउटकम थोड़ा खराब होता है। तो हमें क्या करना चाहिए? डायबिटिक्स को वही प्रिकॉशन लेने हैं प्रिवेंशन के लिए जो किसी को भी लेने हैं। मास्किंग, डिस्टेंसिंग, ये तो लेना ही है। साथ में उनको अपनी डायबिटीज को कोविड के पहले ही कंट्रोल करके रखना है। अगर आप नहीं कर रहे हैं तो रेगुलर ब्लड ग्लूकोज टेस्टिंग करिए, अपनी शुगर को कंट्रोल में रखिए, अपने डॉक्टर से वीडियो या टेलीफोन द्वारा टच में रहिए। अगर आपकी शुगर कंट्रोल रहेगी, ब्लड प्रेशर कंट्रोल रहेगा और तब आपको कोविड अगर होगा तो आपको कोई ऐसे विशेष खराब आउटकम्स का चांस नहीं है।
Dr. Mithil, you're an expert on diabetes and endocrinology, and there's always this worry attached to COVID, and that is of comorbidities, especially diabetes. You know, there's so many vaccines. Is one vaccine better than the other for people who have diabetes, or are they all just about the same and one should not worry too much when it comes to vaccination?
So this is a question that I'm asked about 20 times a day. Which vaccine should I take? And that my sugar is poorly controlled. Can I get a vaccine? All people with diabetes should go for whichever vaccine is available and accessible to them. The level of sugar at that point does not make much difference to the efficacy of the vaccine or to the fact that there would be any complication arising out of vaccination. So please go ahead, take your vaccine. Diabetes, if you have diabetes, there's even more reason to take your vaccine as quickly as possible.
Doctor, what are the three things that India should be doing now to minimize the impact of a potential third wave, in your opinion?
I think there are very basic things. Number one, as we should open up gradually. All of India is not one. There are areas where it will still peak. There are some areas where it has already peaked. So we have to open up gradually. That's number one. Number two, and it has to be area-wise. India is too big to just make a sort of decision about the whole country. Second, we should, of course, ensure COVID appropriate behavior. I'm repeating myself, but masking and distancing is very, very important. Thirdly, and very importantly, we should vaccinate as many people as we can in the interim before this sort of scare of third wave and it actually descends on us. We need to make sure that we have vaccinated most of our population as much as we can, given the limitations. Lastly, we have to make sure we do not de-escalate our healthcare facilities as we did last time after the first wave. We need to make sure that we've added beds, we have ensured oxygen now, that has to be maintained. Drug supplies have to be maintained. We have to deal with mucor, amphotericin has to be maintained. So we cannot let down our guard. And at the same time, we have to ensure we vaccinate as many people as possible.
All right. Well, Doctor, thanks so much for being with us today. You know, I mean, so important, these suggestions, common sense suggestions that really makes a lot of difference to people watching this. We really want to spread this message. Thanks so much, sir. Well, we're joined by a very special guest now, Arjun Kapoor, the well-known actor. Now, Arjun, lots of people you know, your family members, you've all taken the vaccine, which is great. What is that experience like for you?
So, sir, it's very important to understand that the vaccine is very, very important. I think a lot of misconception in the beginning was that we'll wait and watch. I think the most important lesson that we all as people living in Mumbai city who experienced the second wave the fastest, in the sense it came to us the first, we realized there's a lot of protection that comes with even one dose of vaccine. So it's important that we take it seriously, and whenever the chance comes, we should take it. And once the supply is in order, which I know all the states are working in making sure, there are certain side effects which everybody will have, which is a good sign actually. My father took it, my uncles have taken it, my grandmother, my Masi. I have a few people working within the fraternity also have taken it. Everybody has had some kind of side effect, which is a good thing. So I think it's important that people read up and get a little educated about the side effect. It's not a dangerous thing. You will get a bit of fever, badan dard hoga. You will feel all those effects, but at the end of the day, you are protecting yourself from bigger effects. We should not take it lightly. We should not wait and watch anymore. I think we should tell everybody, whoever can, especially above 45, should start taking.
Arjun Kapoor, great to see you. You have so many followers that listen to what you say. Now, what would you want to say to our viewers to encourage them to go out and get vaccinated? It's so important. What do you want to say to them?
It's great to ask questions. It's great to be informed, and it's great to question what is the right and what is the wrong. But at the end of the day, the government has chosen 2 vaccines. They are being procured and being given to people. So please read up about it, but make sure that you sign up for it also, because the future is in taking care of your near and dear ones by vaccinating them, and also by masking up and waiting for your turn to get vaccinated. Don't take it lightly, because we've seen the result. जब सावधानी थोड़ी सी हटी थी तो कितनी बड़ी दुर्घटना घटी है हमारे देश में. We have to keep our guard up and be vigilant. The worst is not over, because we have to head towards it together. And I think it's important that everybody comes together and does their part rather than waiting for things to happen. You have to also be part of the movement. So let's hope people get the vaccine, stay home, stay indoors. We should all use that and make sure that we come out of this more sensible and more sensitive about it.
All right, so lots of sensible suggestions. It's just so wonderful, Nidhi, listening in to people come out, be positive in a situation like this. It's so important to vaccinate, because the battle is not over by any means. The numbers are coming down, but we need to keep it down. And in order to do that, we just must keep on vaccinating.
बिल्कुल, आज का यही मंत्र है कि जहां भी टीका मिले जाके जरूर लगाइए, डरिए मत, हिचकिचाइए मत.
Yes, thank you all for watching. This really is one of the most important topics that we've been tackling over the last 2 hours. There's just one message: vaccinate, vaccinate, vaccinate. Tell everyone you know that the only way to beat this enemy called COVID is to be vaccinated. Thank you once again. Bye-bye.
Tikani suci wani na hana nango. Pula ni suci no simi na har kahangke India. Corona manjage hamza krokbo hammani tal tham ulo tika nai mano. Basa cerai no dut cari nai buma rokbo tika nai mano. Suci kaini no na har kahangke. Baksa ke corona manjagalak te baksa ke corona manjage bo wana ma singsa khai hamya kalai galak. Tika na woi deher derazak na ta kirijak baidi.
ನಮಸ್ಕಾರ. ಈ 2ನೇ ಅಲೆ ಸಂದರ್ಭದಲ್ಲಿ ನಮಗೆ ಮುಖ್ಯವಾಗಿ ಅರ್ಥ ಮಾಡಿಕೊಳ್ಳುವ ವಿಷಯ ಹೇಳಿದರೆ, ಈ ವೈರಸ್ಸನ್ನು ಸೋಂಕನ್ನು ಹರಡಿಸುವವರು ನಾವು, ಸುತ್ತಾಡಿಸುವವರು ನಾವು. ಅದಕ್ಕೆ ಕೈಗಾಲಿಲ್ಲ. ಆ ಕಾರಣದಿಂದಾಗಿ ನಮ್ಮ ಮಾಸ್ಕೇ ನಮ್ಮ ಮೊದಲನೇ ಲಸಿಕೆ.
ಹೆಚ್ಚು ಆಲೋಚನೆ ಮಾಡಬೇಡಿ, ಲೇಟ್ ಮಾಡಬೇಡಿ. ಆದಷ್ಟು ನಿಮ್ಮ ವ್ಯಾಕ್ಸಿನ್ ಅನ್ನು ಆದಷ್ಟು ಬೇಗ ತಗೊಳ್ಳಿ. ನಿಮ್ಮನ್ನ, ನಿಮ್ಮ ಪ್ರೀತಿಯವರನ್ನೆಲ್ಲ ಪ್ರೊಟೆಕ್ಟ್ ಮಾಡಲಿಕ್ಕೆ COVID vaccine is the best treatment option.
ഈ ഓഫീസിൽ തന്നെ 8 പേർക്ക് പൂർണ്ണമായും വാക്സിൻ എടുത്തവർക്ക് ഈ രോഗബാധ ഉണ്ടായെങ്കിലും ആർക്കും തന്നെ അത് ഗുരുതരമായി പോയിട്ടില്ല. വാക്സിൻ സ്വീകരിച്ചവർ ഈ ആശുപത്രിയിൽ പലരും ഈ രോഗബാധയ്ക്ക് വേണ്ടി ചികിത്സയ്ക്ക് വരുന്നുണ്ടെങ്കിലും അവർക്ക് മറ്റ് രോഗാവസ്ഥകൾ, ജീവിതശൈലി രോഗങ്ങൾ ഉള്ളവർ പോലും ഈ വാക്സിൻ എടുത്തു എന്നുള്ള ഒറ്റ കാരണം കൊണ്ടായിരിക്കാം ഗുരുതരാവസ്ഥയിലേക്ക് പോവുകയോ ജീവഹാനി സംഭവിക്കുകയോ ചെയ്തിട്ടില്ല.
இந்த உயிர்கொல்லி நோயாக இந்த கோவிடிலிருந்து நம்மை காப்பாற்ற முக்கிய ஆயுதம் 2 டோஸ் வேக்சின். இந்த 2 டோஸ் வேக்சினை போட்டால் தான் நம்ம சேஃபாக இருக்க முடியும். இந்த 2 டோஸ் வேக்சினை நான் போட்டுட்டேன். நீங்கள் போட்டுட்டீங்களா?
Vaccine hesitancy remains a big issue that needs to be countered if we're to get ahead of this pandemic.
36 lakh Indians have actually vaccinated.
The vaccination rate of India has now doubled. Our vaccinations are now crossing over 1 million, the latest figures.
You must get your jab. You must help us fight the coronavirus.